Now, as the painful economic effects of the pandemic ravage the U.S., homelessness is on the rise. And with the winter months getting colder, people are crowding into shelters where they're in close proximity to others. In Chicago, where there are roughly 80,000 homeless people, health advocates say there's been a COVID outbreak among staff or residents at every single shelter. The city has now added the homeless population to the group for the coronavirus vaccine, to the group that's eligible. NBC News correspondent Shaquille Brewster joins us now from Northside Housing and Supportive Services in Chicago. Shaq, good morning. Thanks for being out in the cold for us. So tell us about this decision to add the homeless population to that second group eligible for the vaccines. Why'd they do it, and what have they learned?
Well, it's too early to know exactly what they learned from it, but this has been part of the plan. You know, these homeless populations, this is a congregate setting. So we know in 1A, for example, we talked about long-term care facilities, things like nursing homes. Well, this is part of that next phase where you have people who are naturally gathering in indoor locations. It's cold out here. The thermometer says 0 degrees. It's a wind chill of 7 degrees below or 7 below. So when you have people going inside, gathering in these congregate settings in places where there have been outbreaks all throughout the pandemic, this is a matter of saving lives. And that's why this group is part of that 1B population, because they know that you can vaccinate them and it helps at least stop further outbreaks in these homeless communities.
And Shaq, other states like California are considering deprioritizing the homeless population for vaccine eligibility. How are people reacting to that?
You have some outrage in California because of that decision, and it gets a little tricky. The officials there say, hey, we're not deprioritizing people, but instead we're adding more elderly people to that initial group of people. And what that will do is then shift down who gets the vaccine. And homeless populations, incarceration populations, they will be now later in that process. Again, it goes to the priority of why homeless advocates are saying this should be a priority in administering the vaccination. One other thing, I spoke to a nurse practitioner here at the nursing facility here, and one thing that she mentioned is that a lot of people who she's dealing with who are getting vaccinated, they have other comorbidities, they have other health issues, and that's why they say, hey, this is a group of people that need to get vaccinated early on, and we need to prioritize vaccinations for this population. In California, you're hearing some backlash to the decision to at least shift who first gets that vaccine.
Now, Shaq, vaccinating the homeless population comes with specific challenges. How are they getting this done?
Yeah, you hear very specific challenges. You know, in my conversations with folks here, you hear number one, following up for that second vaccine. We've seen people and we've seen the vaccination process in other locations. You go through, you get your shot, you get a card saying come back on this date, or go online and set your next appointment. Well, it's harder to do that for this population, especially when sometimes there's not an address, they say. There's not a phone number that they can contact to make sure that people come back for that second vaccine. Another issue that they're having is trust. You know, the nurse practitioner I was talking to, she mentioned it's not about education, it's about engagement. There is deep skepticism with the vaccination process that we see across the country, across many populations. Well, that is only stronger with the population that she's dealing with. So she's trying to engage with people who she sees on a regular basis, tell them that the vaccination is safe, show them that she's gotten the vaccination, and make them feel more comfortable. That's part of the process that they're doing, and that's one of the hurdles that they're working to overcome.
Shaq, also in Chicago, I understand there are more than 16,000 homeless students in the public school system. How have these school shutdowns impacted those students?
You know, Savannah, we've been talking last week, for example, about the negotiations to reopen those elementary and middle schools. And that is part of the reason why, because these schools for many people are not only a source of education, but it's a source of warmth. It's a source of meals. So that has had a negative impact, these school closures. Now, Chicago has had some schools open for meals, for example, or just giving out meals for parents. So they've had that resource, but it's not the same as having your classroom where you have that guaranteed breakfast, you have that guaranteed lunch, and then you go home and you're taking care of those kids there. So it's definitely a problem, and definitely one of the reasons why you hear the mayor, the superintendent of Chicago Public Schools, say that that they're making it a priority to reopen schools because of the resources that these public schools provide.
All right, Shaq, thank you so much.
Hey, NBC News viewers, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.